We are both physicians and we have 3 little kids under age 5. And for the first time in 5 years, this past week, we had a sick little baby and I said, do we need to take him to the emergency room?
Yep, and so with that, this week is all about respiratory viral illnesses in young children, particularly croup. What you need to know to help your kid get better at home and when you need to get extra help. If this is your first time meeting us, I'm Kurt, I'm a board-certified pediatrician.
I'm Sarah, I'm a board-certified OBGYN.
And we are the Doctors Bjorkman.
Welcome back. We have missed you. We have been out for a couple weeks with sick kid after sick kid. 'Tis the fall viral illness season, and with toddlers back in preschool, we are living it here.
Just sick all the time.
Yes.
But we've also been working on a bunch of other content about like sleep learning, baby-led weaning for our now 8-month-old, going through things, getting ready to bring that content to you, and working on a new TDV Plus membership to try to bring more of our content and more interaction with us to you.
Yes. Cool things coming soon. So many cool things are happening.
Yeah.
So back to croup. So if you have ever been woken up in the middle of the night by your child's little terrifying barking cough, and it sounds like this little seal, you know that it can be very scary to feel like your child is struggling.
Yes, and this sound that you're talking about, this classic barking cough or that noisy breathing in, is croup. It is one of the most common reasons parents end up in the emergency department with their toddlers. But here's the good news. Most of the time you can manage croup and other viral illnesses like this safely at home if you know what to do.
We are going to walk you through how to tell when it's serious, what actually helps, and what treatments doctors use when your kiddo needs medical care. So what is croup?
Yeah, so now croup is a viral infection usually caused by a virus called parainfluenza. This classically causes swelling in the upper airway right around the vocal cords. And then it's that swelling that makes it harder to get air in and out and gives that classic both barky cough and that high-pitched stridor sound, which is that noisy breathing in.
It is most common in kids between 6 months and 3 years old, with a peak around age 2. And it's much more common in boys, about twice as often as in girls.
Yeah. Now, parainfluenza infections start like any cold, often with like a runny nose, maybe a mild fever, and then suddenly one night, classically in the middle of the night, that barky cough appears out of nowhere. Symptoms, as I mentioned, are usually worse at night and tend to improve during the day.
Thankfully, most kids improve within 48 hours, and almost all are better within a week. Only a small number, about 1 in 20, need to be seen in the hospital. As a pediatrician, what are you thinking about when you're thinking, hey, does this kiddo need extra help? Do we need to go to the hospital? What are we looking for with a little sicko?
Yeah, we're going to talk through the details of croup, particularly in like when they need to go to the ED and what happens there. But for any viral illness, the 2 main keys are that your baby, young child, is breathing easily and that they're staying hydrated. Breathing easily, of course, when your child has a fever, there can be periods where that breathing gets faster or harder and comes and goes. But what I'm talking about is consistently fast breathing or increased worker breathing. So maybe their little nose is flaring, you see it pulling at the base of their neck, skin pulling in between their ribs or beneath their ribs, big belly breathing, persistently 50 to 60 breaths a minute for more than an hour. So increase worker breathing or fast breathing. Again, sometimes it's good. Get a baseline count for a minute to see how many times they're breathing over a minute, and you can see how that changes. The other piece is hydration. So it's normal that appetite's down when you're sick. Your kid needs to keep drinking. They should have at least 1 wet diaper every 8 to 10 hours, 3 over the course of 24 hours. If they're not hitting those metrics, those can be big red flags that say, hey, at least call your pediatrician. The key things are when do you need to go to the emergency department before we can even talk about how to keep your kid home. When do you need to get that extra help? First on this list is stridor, that noisy breathing at rest, that high-pitched noise even when you're not coughing.
Yeah. Trouble breathing, again, that work of breathing, pulling at the ribs or neck.
Yep, if that's persistent for a half hour, an hour, especially if there's not a fever, go get help. Also, if you're seeing bluish face, they're like changing color, their oxygen levels down, definitely like that would be a red flag sign to go.
Yep, and with that you might be seeing bluish lips or face, as well as if you're seeing drooling or trouble swallowing.
Yep, or also if they just seem like they're really tired, they're struggling to breathe, there can definitely be an additive effect, or over time they've just been working for a long time, that they're starting to actually tire out.
Or, most importantly, if your gut tells you something is just not right, always trust your instinct.
Yeah, that like intuition as parent that you have,
Yep.
trust it
You
for
are
sure.
the expert on your kiddo, and if it just doesn't feel right, your healthcare team, your pediatrician does not want you worrying at home. Call them, go to the emergency room. We want to take care of you.
Or there's often a lot of great times to even just check in with your pediatrician.
Yep.
There's a lot of places where the first step can just be the pediatrician rather than going to go to a busy ED.
Yep. Call your
So,
pediatrician.
absolutely.
Yep. So, what are some things that your pediatrician would say, hey, here's some things to try at home if your kiddo isn't so sick, they need to go to the emergency room right away? What are some things to try at home?
Yeah, so number one, like that stridor is actually made worse by agitation. So the first thing is try to keep your kid calm, which I know it can be so hard when they're sick, when you're nervous, but crying, panicking makes that airway tighten up even more. So hold your kiddo upright, soothe them, keep them in your arms, keep your voice calm. Sometimes that alone can make a big difference.
Number two thing is cool air. Studies show that taking your child outside in the cool night air for about 30 minutes can actually help ease that swelling in the airway. It's kind of like nature's anti-inflammatory. If it's cold out, bundle them up and step onto the porch, go near an open freezer for a few minutes and let them breathe in some nice cold air.
Yeah, that's one of the benefits of croup hitting in the fall winter season, is that maybe the nights and early mornings are a little bit cooler outside, so you actually get this benefit of cool air. Sometimes people talk about, what about steam or humidity? In particular with croup, that old adage of sitting them in a steamy bathroom, the evidence is actually kind of mixed about this. It doesn't always help that upper airway swelling. It can help mobilize congestion if that's part of it, but for most of the time, croup in particular, there isn't as much congestion. It's more just that the airway itself is swollen. Maybe the steam is going to help them, but if you feel like you're fighting to have your kiddo in the hot steam in the bathroom, don't fight them, and also make sure to not put them directly in hot steam, avoiding burns and things like that.
Right. The final thing to do is to treat a fever and keep them comfortable.
Yeah.
So you can use acetaminophen or ibuprofen for fever or discomfort, and encourage fluids to prevent dehydration.
Yeah, we definitely saw how much fever played a role in making the symptoms for our little one this past week worse. So treat the fever. Talk to your pediatrician about dosing of Tylenol or ibuprofen.
Yep. So if you get to this point and you've tried some of these at-home things and your kiddo doesn't seem like they're getting better, or you're kind of feeling uncomfortable about where you're at, now is a really good time to check in with your pediatrician. Most pediatricians have an after-hours line, or if it's during the day, you call and you let them know what's going on with your little kiddo, and they will help you triage what your next step should be. Hey, do they want to bring you into the office for an urgent add-on visit where sometimes they can do some in-office treatments or prescribe steroids or different things like that? Or do they say, hey, this sounds like we want to send you right to the emergency room? But this is a really good time to check in with your pediatrician.
Yeah, trusting your primary care doctor who knows you, knows the area the best. And there's also this classic thing of like putting your kid in their car seat, and then that cool air with in the car ride, maybe the windows down, helps them. And by the time they get there, they're going to look better than they do at home. But definitely seek that help.
Yes.
Whether you end up in the office at your pediatrician, your primary care provider, or at the emergency department, the first thing that they're going to do is to assess your child and say, hey, how much work or breathing are they doing? Is this someone who's got severe croup and needs extra support and actually airway safety measures? Or is it someone that they can think about either using maybe a nebulized treatment or just giving an oral steroid? When it comes to the steroid, the nice thing about croup is it often responds even in a couple hours after that first one-time dose of steroids that really helps relax the inflammation in the upper airway.
So if you get there and your kiddo's breathing is really labored, it's really noisy, they're having a lot of that stridor while they're at rest, they're going to think about potentially using like a little breathing treatment, a nebulizer treatment.
Yeah, and particularly for croup, they give, it's called racemic epinephrine, actually like quickly helps the airway swelling shrink down. It's different than the treatment you might get for asthma or things like that, but maybe they'll try one of those too, because sometimes there can be a component of both upper and lower airway things that can help the lungs relax, help the airway relax, and help your child breathe more easily.
And one important thing to know is since croup is caused by a virus, antibiotics don't help. So that isn't one of the things that is usually added with croup.
Yeah, and the added benefit of going to see your provider or the team at the emergency department is they're going to think about a list of other things that could potentially look like croup. Is there something in the airway? Do they have another infection of the upper airway? Other illnesses to make sure that you aren't missing something else? This is the benefit of getting medical help when you're worried about your kiddo.
So little Hankster was pretty sick.
Yeah, all the kids got it, but Hank definitely was the most worse for the wear. We mentioned, like, in 5 years of being parents of 3 littles now, like, this is the first time, like, hey, does he need to go to the emergency department?
Yeah, I said this is the first time. I sent Kurt in multiple times in the middle of the night to go check on him and make sure he was breathing, like, okay, and is he okay? And that was the first time. So that was wild.
And so, like, some of this is like, hey, like, what did we see? What do we do? Yeah. Definitely, like, there was a lot of noisy breathing. We've got some video. We'll play, like, some of the noise of his, like, kind of his barky cough and that noisy stridor.
He had a fever, and he was just sad and sweet and pathetic and poor little guy.
What a sad face.
Sweet baby.
But even what we have in the videos is, like, not nearly as bad as he was when he had the fever. Like, we got video when he was relatively stable. Like, there were definitely some moments, especially in the middle of the night, where, like, oh, like, he had stridor at rest, that noisy breathing at rest. Noisy breathing. Would have been appropriate to consider going to urgent care emergency department for those symptoms.
Yep, and Kurt said we're going to give him some Tylenol, ibuprofen, one of them, and I took him out on the porch, sat on the porch. I said, why don't you go
feed him breakfast outside on the porch? It was, like, fortunately, like, the first cool morning of fall.
It was cold, and I sat on the porch with him from, like, 5 a.m. to 5:30, and he really just perked up. He got some meds, and he got some cold air, and he was like a different baby, and we called our pediatrician, and little guy got some steroids and was like a different kid by the afternoon.
Yep. Yeah. But, like, still thinking about managing those things, like, the next night, and with that too, you know, I've been asked a ton of times by, like, my parents of kiddos with congenital heart disease or other things, like, what about home monitoring? We actually got sent, Owlet sent us a dream sock about a year ago.
Like, before Hank was born. And I said, don't we have that Owlet somewhere?
Yeah.
On a shelf? Can we pull that out so we have an oxygen monitor on him at night? Like, night 2 or something?
Yeah, we've literally in 5 years, we've never needed one of these, but this was one of those times. It was really nice to be able to say, like, hey, I can look at my phone, I can say, hey, his oxygen number is perfect. You know, in kids who are really working to breathe, like, if they're, like, starting to struggle, their oxygen number starts to dip sometimes as they're starting to retain more of that CO2 or other factors that are going on that says they're struggling to breathe. So it was a really nice piece of reassurance. I will say these are...
What did you say to me? I was like, is his oxygen level okay? And you said hypercarbic or low oxygen kids. What did you say? Something. And I was
if you don't have a monitor at home, if your baby is breathing comfortably, then you don't need a monitor.
Oh, yeah. Right? I think you were like...
I was like, hey, he's not breathing fast.
He's not tachypnic or something. And I was just like, so just put an oxygen.
If you don't have a monitor at home, which, like, we didn't use it for the first night, if your baby is breathing comfortably, their oxygen level is fine. They, like, have sensors in their body that, like, they're designed with that says, hey, my oxygen level's low, I need to breathe harder. My carbon dioxide levels are getting high, I need to breathe harder and faster to get rid of it. And so if your baby is breathing comfortably 30, 40 times a minute, maybe there's a little bit of extra work at breathing at baseline, but not a ton, you can know their oxygen level is fine. It was nice for us to be able to say, like, hey, from the other room.
That did make us more comfortable that night that he was sounding really bad, that, hey, he's breathing okay, his oxygen level is totally fine, let's try to keep him comfy, take him outside. I will say that probably helped us keep him home because we were comfortable.
Do you absolutely need an oxygen monitor? No. Absolutely not. Like, when they study it, they are good. They aren't perfect. It's not like being on an oxygen monitor at the hospital.
Right.
But it can give you some good, valuable information to at least, like, give you some reassurance in the night if that's something you need.
It was one of those things where we're like, I think let's pull that off the shelf. Let's try that.
Yeah.
And it was good. We liked it. It was useful.
Yeah.
We haven't continued it since.
No,
but
we used it one night.
when he was super sick, and it was nice. Yeah.
I'm trying to think other things that were really key. Like I was drinking well. I said the big goals for baby, easy breathing and hydration. So he drank well. He was having lots of wet diapers still. We knew he was staying hydrated. And then really those keys of like what to do at home, stay calm, treat the fever, and cool air.
Yep, sat outside without socks on.
Oh yeah.
That was not a smart move for me.
I checked on you to bring you a blanket, but I didn't.
Yeah.
We didn't talk about getting you socks.
My
Sorry.
toes are cold, folks. But poor little hand, it helped him a lot.
We did try the shower
tried
trick
the
too.
shower.
Like we did the shower trick. Like he got a bunch of snot out after we did that.
Yeah.
Like if there's any benefit of like being in the bathroom with like the hot steamy shower running in the same room, so that they're like breathing in that warm air, it can loosen up some congestion. It didn't make a difference on the stridor at all. Like it, of course, like it's not helping the airway swelling. That's the cool air.
Yeah, but it was the first illness where I was like, what are we doing?
Yeah.
What are we doing here?
Maybe you've wondered if we get nervous as parents sometimes.
Yeah.
The answer is yes.
Indeed.
So you are not alone there.
Indeed.
We are here in real life with you.
Yes. So that was our experience with our little sicko with Croup. It certainly.
Yeah, it was like this realization. There's been so many times in our parenting journey where like, what do we do with this? Or like we are feeling nervous. So if you're feeling nervous about your little kiddo, just know that we're physicians
doctors,
and we get nervous too. We are here with you. That's why we're here. That's why we're so excited about bringing more community to you and helping you join our lives and us join you. If you're interested in that, check out some of the links below. Give us comments about experiences you've had with your own little kiddos.
Yep. And try to stay healthy this cold season.
Yeah, good luck, guys. We will see you next week.
Bye.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.